All right, so we're going to go ahead and get started because I know there's a lot of great information to cover today. So welcome everyone. My name is Elena Kidd and I'm a program director within the University of Alabama at Birmingham School of Public Health. And I'm very excited to welcome back Dr. Katrine Wallace from the University of Illinois at Chicago School of Public Health, who will be presenting today's webinar, Strategies for Combating Health Misinformation. This webinar is made possible by the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance Center, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division and the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center, sign up for our newsletter, view and listen to past webinars and podcasts, request training and technical assistance, or view our resources at uab.edu/ARC-IPC. And you can also email ARC-IPC at uab.edu with any questions. We would like to thank our co-sponsors for today's webinar, the Region 4 Public Health Training Center. You can learn more about their programs, trainings, and the center as a whole at the website listed on this screen. We'd also like to let you know about our next webinar, the ABCs of Viral Hepatitis Update for Public Health Professionals on October 18th with Barbara DeBon. This virtual webinar will provide a snapshot of viral hepatitis epidemiology and an overview of the 2021-2025 U.S. National Strategic Plan and Roadmap for Elimination, which is highly relevant to the public health community. This webinar will include a discussion about the current surveillance data that reveals trends, challenges and opportunities, and information about prevention through vaccination and approaches to treatment. This webinar will be presented by the ARC-IPC and co-sponsored by the Region 4 Public Health Training Center and the Deep South Center for Occupational Health and Safety. Then on November 1st, we are hosting a webinar with Dr. Matt Brown titled Protect and Preserve: Priorities of Antimicrobial Stewardship. Antimicrobials are essential for modern medicine. However, they become less effective over time. In addition, adverse effects and other negative consequences of antimicrobial use are not uncommon. In this presentation, Dr. Matthew Brown will provide an overview of antimicrobial stewardship and how it can help protect patients and preserve the utility of these important medications. This webinar is presented by ARC-IPC and will be co-sponsored by the Region 4 Public Health Training Center and the Deep South Center for Occupational Health and Safety as well. And finally, it's my pleasure to introduce our speaker, Dr. Wallace. So Dr. Wallace holds a PhD in epidemiology and has over 15 years of professional research experience in epidemiology, research design, pharmacoepidemiology, health economics, outcomes research, and biostatistics. She is currently an epidemiologist and adjunct assistant professor of epidemiology at the University of Illinois at Chicago School of Public Health. She is also known as Dr. Cat on her popular social media channels, where she educates on epidemiology, vaccines, and the COVID-19 pandemic. She has been an invited speaker in the US and internationally, and has presented research at over 20 scientific congresses. A vaccine advocate, she serves as a member of Team HALO, United Nations Verified Initiative, Project FIDES, a World Health Organization initiative, and was chosen as a vaccine luminary for the 2021 G7 Vaccine Confidence Summit. Dr. Wallace has also been featured as an opinion contributor for The Hill and has been interviewed or profiled in several mainstream media outlets such as BBC World News, The Washington Post, Good Morning America, Bloomberg, CBS News, and National Public Radio. So without further ado, it's my pleasure to turn things over to Dr. Wallace.
Thank you so much for that nice introduction. And thank you so much for having me back, and for everyone on. If you were at my last presentation, I'm going to do a part 2 today of what we did last time. So apparently so the last time I was doing this, we did a lot of what is misinformation, how people, the strategies people use to spread misinformation, just so that we would know kind of what to see and how to identify it, right? And what are the kind of ways that people do it. And it was almost like psychology. We're talking about cognitive biases and things like that. So today we're going to sort of do a part 2 to that, where we're going to talk about what can we do about the misinformation. So our objectives for today's talk is, and I have a lot to cover, so I'm going to go at kind of a clip because we got a lot of cool stuff that I want to make sure that I get through. So the first thing is we're just going to review misinformation and disinformation, because it's a really important distinction to make when we're talking about the spreading of false information. Explaining why it's such a widespread public health issue and how it kind of gets embedded into society. And then we want to learn strategies to combat this. And I don't promise to have all the answers. I'm just somebody that has been working in this space for the last 2.5 years every day, and seeing it and dealing with it myself. And then also, as Elena mentioned, I work on some science communication initiatives with the UN and with the WHO. And I also have been connected with the Surgeon General's office because they're working on initiatives to fight misinformation as well. So in all of these kind of capacities, I have sort of figured things out along the way. So I want to share with you what I've learned and what I think would be good strategies to combat this problem. So what is, just on a very basic level, what is misinformation? So it's just any information that is false, inaccurate, or misleading, according to, and this is really important, the best available evidence at the time. So this isn't retroactively assessed with current evidence. And this is something that you'll see a lot. And I have the child in the mask at the bottom because this is a perfect example. You have heard people say, well, Fauci lied at the beginning of the pandemic because he said we didn't have to wear masks in, February of 2020 when we were first hearing about COVID. And that was the best evidence we had at the time, because at the time we thought of it like the flu virus, where your symptomatic period is kind of simultaneous with your viral shedding period. So that's what we sort of thought was happening until we collected some more real world observational data to show that no, there is pre-symptomatic spread and there's actually asymptomatic spread. So we should have everybody be masking. So this is one of those things where, like, you can't really retroactively say like he was spreading misinformation then, because you need to assess what is misinformation with the information you have at the time, because the science moves and data gets collected. So that's an important distinction. So who is vulnerable to misinformation? Some of these are obvious, but everybody, we all are, even me, right? It's oftentimes packaged very cleverly, but misinformation will always only tell you part of the story. So if you look at this slide from the United Nations, I really like this one because it's like Little Red Riding Hood and then leaves out a lot of information, lived with a wolf and she lived happily ever after. So that's all true if you know the story, but it's leaving out a lot of other parts, right? So that's it. Sometimes misinformation starts with a kernel of truth, but leaves out a lot of information or misleads, and so that you think it means something else than it really does. So a problem is that misinformation is far more common than we think it is. Like you think everybody is not believing misinformation, but that's really not true. The KFF, the Kaiser Family Foundation, does this survey every quarter called the Vaccine Monitor. And in the fall of 2021, they released this data that shows that nearly 8 in 10 people, about 80% of people, believe or are unsure of at least one common falsehood about COVID-19 or the vaccine, which was a lot of people, right? So it's very widespread and oftentimes is spread on the internet via texts or emails or social media posts. So kind of outside the regulated areas of like public health. And so it's like from person to person spreading. So that's bad because, about half, the Pew Research Center determined that about half the people get their news of like their news of the world, not just health information, but any news on social media. So, and this didn't really change much between 2020 and 2021. So we really need to meet people where they are, which is on social media. And social media people, unfortunately, due to this other survey, are more likely to believe misinformation than people that get their news from other sources. So social media is great because it meets people where they are. It's a modality that I use to communicate data and accurately, data quickly and accurately, right? It makes important information kind of fun. You can sort of be creative and spread information in a creative, fun way with music or whatever. The cons are, of course, that people's attention spans are really short. And these algorithm driven platforms, which I'll talk about in a second, kind of favor misinformation. And that the reason for that is because engagement drives how often you see certain content. So if you're a person that likes cats and you like all cat pictures, you're going to keep seeing cat pictures because that's what you like and that's what you engage with, right? So someone that engages with anti-science or are interested in conspiracies or things will keep getting shown that content, right? So these algorithm driven platforms are just designed to keep people on the app. Whatever they like, they'll keep showing them more of that. And so because of this, sensational viral content that are like, oh, here's a secret the government doesn't want you to know, or something like that. Those videos and those posts get more traction because they're sensational. And so oftentimes misinformation wins over like evidence and data. So me saying you should wear a mask is going to not get as many views as like somebody saying like Fauci lied and said we had to wear masks, like because that's like, wow, we didn't know that. So this is the problem with these algorithm driven platforms. So health misinformation can also be spread in other ways, not just social media, although that's probably the biggest. Speeches, we saw a lot of these like school board speeches where people were railing against vaccine mandates and masks, and it was a lot of misinformation being spread in these forums. Nobody's sitting there fact checking, right? Pamphlets and posters, we see a lot of anti-vaccine pamphlets, distributed to people's houses, left on shelves at grocery stores, all kinds of bad information just kind of disseminated. News outlets, there's news outlets that are just fake news outlets that were created just to spread propaganda and disinformation. Advertisements, they're just in like 2021, Facebook said they were no longer going to sell ad space to anti-vaccine organizations. So they would take out ads on Facebook so everybody would see them. Books, a lot of the disinformation spreaders are selling books, and even face-to-face conversations. So people who you meet at church or at your child's school or something might, tell you something that you're like, oh, I didn't realize that. So these are all other ways that misinformation spreads. Okay, so disinformation. So sometimes misinformation is spread intentionally. So this can serve a malicious purpose to try to trick people into thinking something or believing something for a person's financial gain or a political advantage. So this is what we call disinformation, like the purposeful spreading of misinformation. So the difference really between misinformation and disinformation is this intent, right? So disinformation is like intended to harm or mislead, whereas misinformation is still involving the sharing of false information, but it's really not intended to harm. It's more of like a passive sharing of the disinformation. And who would do that, right? So a lot of doctors, politicians, celebrities, and activists will spread disinformation, and not uncommonly with selfish motives. And I highly recommend this article if you haven't read it. how wellness influencers are fueling the anti-vaccine movement. It's from the Washington Post on September 12th of 2021. It's a very good one that kind of explains this phenomenon from a wellness influencer perspective. And when the Center for Countering Digital Hate did an analysis of Instagram in 2021, they found that 65% of all the anti-vaccine information that's anti-vaccine misinformation was originating from 12 individuals. So they called these 12 individuals the disinformation dozen. So again, why on earth would they do this? Well, social media it can serve as a storefront for these individuals. They have a page, there's a link in their bio, and in there is the books they sell, the vitamins they sell, and all the other products, coaching, retreats, all the things that they have for sale. And this is a huge industry, and it's only increased over the pandemic. And this report from the Center for Countering Digital Hate assesses that growth in the industry over the pandemic and all of the things these people are selling. And the thing about this is that these people don't need a sales force to sell their products because they create these shareable memes and people just share them for free. So this is a big industry. And you might have seen on, I think it's Netflix, there's a documentary about Joseph Mercola about how he's profiting off of health misinformation during the pandemic. So that's the disinformation side of things and how it's profitable and how it originates. But why do everyday people spread misinformation? So who's doing this? So most of the time, people who spread misinformation have no idea that they're doing it, right? So people don't really know that their claims are false or misleading that they're sharing. They're forwarding something maybe shared by their sister or their neighbor or somebody they know and think is a normal person. So they're like, oh, well, if that person thinks that, then it must be true, right? Because we're influenced by our social circles and they want to help people, right? You want to make sure people know what's going on. And a lot of people who share misinformation might be really concerned about this thing that they're sharing or making sense of a really kind of scary, out of control situation. And if you don't have a degree in immunology, maybe this misinformation helps you connect two dots that you otherwise couldn't connect. So it's an easy way to get from point A to point B in their mind, right? It's like, oh, well, it's all a hoax. Okay, that makes sense to me. But maybe the immunology doesn't, right? So it's making sense of kind of some hard, scary information and seeking honest answers to questions people have. So I think a lot of people just are kind of thrown into this sharing of misinformation because of just not knowing what's true, right? And so, why people do it is like people like to feel like they have new information that others don't know. And we see this a lot on social media, why things go as viral as they do. Posts like this one, the doctors are hiding important information about the vaccine. Listen to what this nurse says about it. And then there'll be like one disinformation person, this fringe person with these ideas that are not the mainstream, right? But that gets shared a lot because people like to have new and interesting, intriguing information to share on social media. And then also people might really just want to protect people they care about. They hear something is dangerous or bad. And like this lady's like, sometimes I share things without checking it because I'd rather be safe than sorry. You hear that a lot, like, well, if the vaccine's dangerous, I just don't want to be the guinea pig or, so something like that. People might be, again, seeking explanations to help them make sense of events like we were just saying. Like, have you seen this video? I don't know who made it, but now everything makes sense. There's all these YouTubes that people send me in my comments all the time and, that are like an hour of somebody opining about something that we have no data to support. But to them, that now makes everything make sense, right? So, lastly, people want to feel connected to other people. That's the point of social media. And these echo chambers, people make friends, people are involved. it's really a community. So that's tough to break through. So what can we do? What can we all do to fight misinformation? That's the purpose of why we're here at this talk today, because last time we talked a lot about all the techniques people use, the disinformation spreaders use, but conspiracy theories and appeals to emotion, appeals to fear, cherry picking. We talked about all of those. So what can we as individuals and communities do? So it's really a multi-layered approach, and there's no one layer that's going to be successful at this. It has to be all of it. So on a personal level, we can affect things. On an interpersonal level, we can talk to people, communities, organizations, and then finally policy. So it has to be all of it. So let's talk first about what we individually, personally can do to fight misinformation. So we can verify whatever we share online. And I do it every day because I'm terrified of spreading misinformation, because that's my whole purpose, right? Of fighting misinformation. So everything I post, I make sure to check it like 100 times, because if I have anything up that's wrong, I feel like, that's really bad. So I'm constantly verifying everything. So misinformation, even for me, like I said, can be hard to detect. So verify before you amplify. This, I love this graphic from the United Nations Verified Initiative that I've been working with. They have this: before you share, think who made it, what is the source, where did it come from, why are you sharing it, and when was it published? So all these are really important questions to help you verify something before you amplify. So then the first thing that you can do when you find a piece of misinformation is check to see if the CDC or a local public health department if there's any backup information for your claim from a real source, right? So you can find out if there's anything going on that's, worth sharing, because if you just see it somewhere, it's probably not true if you can't find it another place, right? Another thing, it's really important, is making sure the information is current. So check the date on what you're sharing. So a lot of times you'll see like a picture. I think it was like a month ago, there was a picture flying around the internet that was like Barack Obama, Anthony Fauci, and then some scientist, and they were saying this was them visiting the Wuhan lab, and that this was when they started talking about the engineering the virus and all this crazy stuff. But it really was in Bethesda at the NIH lab, and it was like back in like 2010 or something. So it was a really old picture, and it wasn't even where they said it was. So nothing in those misinformation, except for the fact that the people were in the picture, that was the only thing that was correct. So another thing you can do is ask some credible health source, a person or your doctor, if they have any additional information. If it's something you've never heard about before and you can't find it anywhere, that's another option. Another thing is that you could look at things, like the CDC or something, some other credible source, and kind of type the claim into a search engine and see what pops up. If it only pops up on kind of fake news propaganda websites or, the media, and not on sites like Mayo Clinic or NIH or CDC, it's probably not true or has been exaggerated or twisted somehow. If the information, like I was just saying, is only on one website, it's probably false. And you can always look on each website at the About Us part and see if you can trust the source. So this source I'm using as an example because they have been extremely problematic through this entire pandemic, the expose. And they have this newsletter that goes out every day called the Daily Expose. And it's basically bad information. And so if you look at their About Us, it says the expose was set up due to a lack of alternatives to the lying mainstream media. And so you can already tell that this is not professional, right? That this is just a propaganda website. So you can look at the About Us, and then it pretty much tells like what their mission is. lastly, what we can do as individuals is you can make sure that the person making the claim is actually an expert. So just because somebody's a doctor doesn't mean that they are an expert in this thing that they're talking about, right? So are they board certified in what? Have they published papers in this area? Do they have an appointment somewhere where they're practicing medicine? A lot of the doctors that are spreading misinformation during the pandemic are have medical degrees, but they aren't practicing anymore. They don't have any papers in infectious disease. They might have been board certified in the past and they aren't anymore. Or maybe they are in like ophthalmology or something. And it's just, people that are doctors, yes, they're more knowledgeable than the layperson for sure. But would you rather listen to a person like that or the scientific consensus of people that study this every day, day in, day out, infectious disease, physicians, vaccinologists, virologists, epidemiologists, people that do this for a living. So just make sure that just because someone's a doctor doesn't mean that they are an expert on this exact thing. Okay. So for us personally, verify everything that we share. And like I said, I'm not exempt. I do it every day. Interpersonal level. So this is the part I'm going to spend sort of the most time on because this is the part that we feel very powerless because we have people in our families, we have people who we went to high school with, we have people at work that believe misinformation, and we feel like we can't help because it's really hard. It's very difficult. This is the hardest piece. So communication is key. And it's hard because these conversations get so frustrating that communication often just breaks down. But sometimes we just can't fully understand why somebody is doing it. And figuring out why somebody believes or spreads misinformation is important because their intentions oftentimes can't be boiled down. People are complex. People have different, we tend to believe things that kind of agree with information we already have on file, right? So our cognitive biases are there. So mine are scientific, right? My biases lean towards like, okay, how do I explain this using science? Some people are religious and they default to that. Some people are very political and they will default to their politicians. There's your biases lean towards where they're going to go no matter what. So we all have them. If to say you don't have any bias is a bias in and of itself, right? Because we all do. So their intentions can be mixed, unclear, or even mutate over time, right? So they may not fit nicely into this, oh, she's an anti-vaxxer. Because some people will get all their vaccines, but just not the COVID vaccine. Or some people will believe in, getting plastic surgery or something, but then they won't go to the doctor to get like basic preventive care. So it's really interesting how people will have different intentions. So just communicating with people about exactly why they believe something is important because you might learn something, right? So again, communication is key. Rather than quickly jumping to a conclusion about that person or calling them out, it's really hard, I will tell you, but try to first listen and engage in a conversation with that person about what's going on in their head. So here are some examples of how we can listen with empathy, right? So imagine you have a friend who is worried about a potential side effect and that they read about online from the flu shot, right? And the source that they read, maybe they read it in the daily expose, right? So this source is not reliable. So you want to first listen. You want to listen to what they're scared of, what they believe, and you want to focus on the big issue, right? How they feel. And remember that automatically fact checking is going to shut down that conversation. So if you start throwing data, and I know this from experience, if you throw data at somebody who has beliefs that are very strong, they're just going to double down. So then you need to empathize with these people. And this is assuming that you like the person enough to spend this much time, right? A lot of times you're just like, okay, whatever, online. But emphasize the fact that you understand why it's difficult for them to trust. Now, think about it. Sometimes people have had bad experiences with the medical system. Some people have had some trauma. There is, cultural trauma that has to do with the medical system. So there's reasons for people to believe misinformation or not want to trust the healthcare system who's spreading correct information. So, ask questions, try to understand people, admit that you yourself have struggled at some points with misinformation. That kind of helps put you on a playing field and not like you're up here understanding everything and they're down here not understanding. If you admit that you've also struggled, like for myself, way before I was an epidemiologist, I was a mom, and I tell people now that I used to read Dr. Sears, like back when he was really popular in the early 2000s. And I remember him saying you should spread out your vaccines because it's safer. And I was like, okay, I need to spread out my vaccines because it's safer. I had no reason to think that other than that I read it in Dr. Sears. So I like to talk about that with people that are scared of vaccines because I wasn't scared and I always got, my child vaccinated, but I did struggle with that. Like I was like, okay, maybe too many together is bad. And, this was, like I said, before I, I was an epidemiologist, but I wasn't I wasn't a stupid person. And this was what I thought because I read that someplace. So I like to bring up times in the past when I myself have struggled with misinformation. And it helps kind of equal the playing field, right? So another way you can do it, so you can help people by steering them towards good information and just asking them to consider it, right? So imagine your uncle has been diagnosed with a serious illness and is convinced that an obscure cure being sold online from one of our disinformation dozen maybe will help him, right? So what you can do here is just point towards credible sources for treatment and information. So underscore that finding accurate information is really hard. So, again, use non-shaming language, emphasize the need for credible sources. These are the experts, just at least read it and remind them that an expert on one topic, like we said, some of these doctors might not be the best source of information on this other topic. So pointing them towards credible sources and just asking them to consider this too can be helpful. Again, like I just said, don't use a shame tone or shaming language. So if you imagine your neighbor has started following conspiracy communities online and is beginning to believe outlandish claims, like to shame them is just going to push them further down that rabbit hole, right? So try to have, again, conversations one-on-one. Having conversations in the comments under one of their Facebook posts, not helpful. So that's got a potential to backfire. One-on-one conversations are better if you can. Be gentle and empathetic, and shaming is counterproductive. Another thing that's great to do is what we call the truth sandwich, right? So if your sister has been reading a news source that reports misleading statistics, and she's saying she won't get the new vaccine booster because she read it was dangerous, you can sandwich the misinformation between two truths. So you start with the truth, and so the frame gets the advantage. So how you start, and then indicate that some people are saying XYZ, what she probably read, and then return back to the truth. But, we know that's not true because blah, blah, blah. So if you do this truth sandwich approach, that tends to be better than just saying that's ridiculous or, something like that. Inclusive language is important. Imagine an old friend is sharing misinformation about some new diet that you think is maybe dangerous and extreme. You might want to say, like, sometimes you also struggle with, your weight, or, use language that makes it clear that you yourself are impacted, as appropriate. Sometimes it's, I've been there, done that is not always a good way to handle things. But, if you think it's appropriate and you really do have something to add to the conversation to kind of bring you to the same level, that's good. and just explain that you're interested in their well-being and you're not shaming them. So what about the community organizational level? So that's like if you're talking to somebody that we know we can verify information for ourselves. We know that we can support people interpersonally with real information and with understanding and empathy. For organizations, we can do a lot with education. So education on risk benefit would be great. Humans are really bad at assessing risk. We know that the risk of COVID is assessed as really low by a lot of people, and the risk of the vaccine is assessed as really high. So it's like a backwards thing. And I think it's due to this nature bias where man-made risks, like the vaccine, are perceived as being worse than natural risks, like the virus. And as we know, all of us on this call know that that's not the case, right? So it's like a backwards bias. And then there's also this optimistic bias where people don't think their own risk is as high as it really is. People, how many times have you heard like, oh, I'm young and healthy, I don't need to take the vaccine because I'm young and healthy. Like people think they're young and healthy and they might be in their 50s with heart disease, but they're walking around and they're going to work, so they think they're healthy, right? So education on risk benefit would do a lot. People learning how to assess risk, because we're really bad at it, all of us. Education on news literacy, huge. And this is a group I work with, the News Literacy Project. News literacy in high schools, colleges, and in adult education would be fantastic. Teaching people how to fact check news sources and teaching what are reliable news sources. A lot of people don't understand this continuum here, where you have like your mainstream fact reporting sources up in the middle, right? And then you have this cascade, both directions. You've got a liberal and a conservative cascade going down. And as you go down this kind of pyramid, the facts get a little bit more fuzzy. And when you get below that dotted line at the bottom, this is often factually incorrect sources, right? So you've got like the National Enquirer, which isn't partisan, but it's like made up information, right? And then you've got over here, the liberal made up information. Then you've got conservative made up information. So a lot of people just don't, they take sources at face value and don't understand any of this, any of these, the way that this is on a continuum, right? So it's hard to fight misinformation when this basic information is not even appreciated. Science literacy, science education. Schools need to reprioritize science education. I was very surprised as a science communicator, the low level of science education that there really was out in the lay people social media environment. I had to do a series, as you can see on the bottom, of just basic science videos, walking people through how science works and what's different study designs, how not every study design is going to yield you the same kind of data to make conclusions with, and like levels of evidence. People did not know this information, and that was kind of shocking to me. So because of this lack of science literacy in the general population, the public was very, very vulnerable to this co-epidemic of misinformation with COVID. Education on digital literacy, huge. We should really be teaching this. It's a key skill for anybody who's going to be consuming and sharing information online. And there's room for improvement at all age groups, digital natives and older adults. Digital literacy needs differ between communities. Definitely for the digital divide you hear talked about all the time. Like when we first had the vaccine availability, the only way to sign up for vaccine appointments was online. And so that was hard for seniors. And so digital literacy is just really important in general. Organizations and communities can recruit trusted advocates. And this is a success story that has happened a lot, at least during this pandemic, is using trusted community voices to share positive health messages. And it enables community leaders to reach larger, diverse audiences that they might not otherwise get to, right? So using faith-based organizations, really that should be dialed into public health all the time. In COVID-19, there was great examples of barbershops holding COVID-19 vaccine clinics. And during the monkeypox outbreak in the summertime, at the beginning, there were a lot of bars in gay neighborhoods, that LGBTQ communities that were having, education sessions, pop-up clinics for vaccines. And so this was a way to connect with the community and really get a level of advocacy that wouldn't be there otherwise. Doctors also can be advocates. Using doctors to counter misinformation is huge because people trust their healthcare provider. And it doesn't have to be doctors. That should really say like doctor or healthcare provider, because a lot of people see nurse practitioners, physician assistants, they're all trusted. And these people can steer patients to evidence and correct false beliefs. And you can share information beyond the walls of your office by a newsletter, email blast, social media like I do. So there's lots of ways doctors can help counter misinformation to their patients, but also as an expert to the general community. Social media also, you can counter misinformation at the source by flooding social media platforms with empowering narratives of accurate information, and health departments should all be doing this. Good information, positive stories, you can pre-bunk things you can see coming down the line, debunk things that are already viral, and do education, just basic public health education on these platforms. And pre-bunking, because I get this question a lot, is when you don't wait for the bad information to come out, you start to construct your good narrative before the bad information comes. So you can look ahead, predict what narratives might take root, and get good information out first. And never give misinformation the microphone. This is really hard, but try not to give airtime to bad information. Don't repeat the myth if you can't, if there's any way around it, even to debunk it, because that brings new eyes to the bad information. And people might be like, even if you're debunking it, might be like, oh, is that true? If you need to cite it for context, make sure you center the accurate information and not the myth. So the truth sandwich effect, right? All right. So really quick, lastly, the policy level. This is what government can do. And we have a success story here. So California AB 2098 was just passed about a month ago, signed into law by Governor Newsom. The Physicians and Surgeons Unprofessional Conduct Act was disciplinary actions to doctors who spread COVID-19 misinformation directly to their patients. And this unfortunately does not go as far as social media posts, but it does, it will impact those doctors that are selling ivermectin, hydroxychloroquine, and other non-evidence-based therapies to their patients in the office or on telehealth. So this is huge. It will save lives. This is another, the House of Representatives, Representative Donald Byer from Virginia has introduced a bill on actually news and digital literacy, educating against misinformation and disinformation. And this would actually have programs in schools for media literacy and secondary higher education and adult education programs, and collect metrics on that they're doing it. So this would be great if it were to pass. And also Section 230, the reason that this is such a big problem on social media is down to the Communications Decency Act, which is Section 230 of Title 47. And this section says that no provider or user of any interactive computer platform can be treated as the publisher or speaker of that information. So basically, these social media platforms and websites are protected against laws that might otherwise hold them responsible for what other people say on their platform. So people can spread misinformation on, Facebook, and Facebook is not responsible for that. So they can decide whether or not they want to moderate it and to what extent, but they're not responsible. And this was put together in 1992 when the internet was at its very early stages, right? And so what this was regulating or not is just comments people were leaving in chat rooms and things like that. The internet has far outgrown this as a protection, and now it is basically being used to protect misinformation. A lot of people will say this is freedom of speech and all this stuff, but these platforms are private enterprises, and freedom of speech doesn't really extend to private companies. And this is enabling the spread of misinformation because the platforms themselves are disincentivized to do anything. And Amy Klobuchar, from a Democrat from Minnesota, has introduced the Health Misinformation Act last year to actually amend this Communications Decency Act so that it can show, so that in certain circumstances, these computer service providers will be liable to correct misinformation on their sites. So I'm almost out of time here, but so this is my last slide. So there's 4 levels of societal response to misinformation. All of these play a very different role. So personally, we verify. Interpersonally, we support each other. We support our friends. We listen, we empathize. Community and organizational level, we educate and we advocate. And at the policy level, we legislate. So we all have the power to shape our information environment, but we all need to use that power together. And all 4 of these levels need to work together to fight misinformation. So I have 10 minutes for questions. I did it. I was so worried I was going to run out of time.
Thank you so much again. We had a lot of great discussion in the chat as well. And we have a few Q&A questions. And if you do have any questions and questions that you would like to send to Dr. Wallace, feel free to continue to submit those to the Q&A box. So the first one is, you, along with others like Dr. Tracy Rossetti, became trusted voices of information during the pandemic. Can you talk about your personal editorial process when deciding what information to share when data is constantly evolving? How do we balance the risk of sharing information that is new but not totally proven with the need for transparency during the pandemic?
That's a great question, because I can't always rely on things being peer reviewed, especially during outbreak situations. So during monkeypox, I was using a lot of CDC data and a lot of information that was from technical reports from like the WHO or the CDC. When it is like that, when data is moving so quickly and you can't wait for peer-reviewed publications, which is always going to be, the top tier of what you want to be presenting. But when you can't do that, at least I try to make sure that I'm verifying all, like if I see a news site that says like monkeypox is spreading in schools, I'll be like, what? And then I'll make sure to go and check with CDC, with WHO, with any place that I can to make sure that's either right or wrong. It's not, by the way, but that was an example of like how I would verify. I would use a reputable source, because like that commenter said, it's not always possible to have like the peer reviewed science as everything's moving so quickly.
Thank you. So next question, we had a few more come in, but in the last several years, especially as it relates to vaccines, we have teachers who don't believe in science, healthcare workers who don't believe in medicine, and police who don't believe in public safety. What's your take on this?
Yeah, so I think it goes back to what I was saying about the cognitive biases that we all hold, and also the communities that people form around these. So I think sometimes, like, I'm a scientist first, and that's my community. My friends are scientists, like, especially during this pandemic, I've been sort of like, even more so kind of hanging around with my science friends. But I think some people, even if they're teachers or, police officers, their social group may be, politically and unfortunately politics has become involved in a lot of this misinformation sharing, and you know the cognitive biases that they have on file and that their social group kind of revolves around may kind of play that politics may play into that. So it is unfortunate because these are like public servants and nurses and things, and you know it's just, I think a lot of it has to do with that, with the social groups, kind of the peer pressure around what you think and believe, and cognitive bias.
And so the next question is kind of combined too, because they are very related. So one question we have from an audience member is, I know someone who is spreading misinformation. She was encouraging people to do their own detective work regarding her false claim, but warning people not to investigate any sources connected with the government, like the CDC, NIH, because they were untrustworthy. How does one respond to something like this? And it kind of tags on to the other question we got, is about, how do people share credible sources such as the CDC or health department when people don't trust those sources?
Yeah, so that is a problem. But what I always kind of try to, this is the conspiratorial thinking that is really, really dangerous. Like people who think that all government agencies are out to get you and that they're all trying to trick you. And it's really, the fact that there are so many people that believe that is actually terrifying. And if you say something like, oh, well, if you don't want to look at the CDC, then you could look at the WHO or European data. They'll say, oh, no, it's all the World Economic Forum. And it's all, and so it's kind of like, wow. But what I can really say is that, we have a body of evidence, and this is kind of how I present it to people. We have a body of evidence and a consensus of scientific thinking around a topic, and that evolves all the time. The body of evidence evolves, the consensus evolves, but these are agreed upon by the majority of experts. And there is a fringe group of quote unquote experts and people that think otherwise, but these people don't have data to support their claims, because if they did, it would be part of that body of evidence. So people like Dr. Malone, will go on Joe Rogan's podcast for 3 hours opining about what might happen with he doesn't have even one case to support any of the things that he's talking about, because believe me, if these guys had something to publish, they would, but they don't. So I just try to bring people back to the body of evidence, and that the CDC is using that body of evidence. They're not just making decisions to make decisions in a vacuum. They're informed by the evidence and the experts that create that evidence.
Next question we have is, are you seeing low bias sources, like the ones on the media chart, like NBC, beginning to move to the right or left now?
I guess I haven't noticed that about I have noticed like CNN is moving a little bit more to the right. I think I haven't really noticed that with NBC or CBS or any of those. I think those are still pretty fair balance. And actually, I will say that since I've been doing this, I've been working with media a lot and being interviewed and talking to, and I actually have a lot of respect for media and what they do now. Not all media, obviously, but like the mainstream televised media, they do a very good job fact checking and making sure things are correct. And I can't imagine being able to go on one of those shows and spread misinformation, because I feel like the producers already kind of are very familiar with the topic before they even ask me the questions. And they'll ask me to send things to them sometimes, if like we have like a little pre-interview, and then they'll ask me to send them the sources I was talking about in our pre-interview before we have the actual live interview. So I feel like they're very good, and they're better than I thought they were. Let's put it that way.
So I think we have time for one more question. How can we initiate legislative change in our states? That came from someone in the chat messages.
I need to be more dialed in with that process myself. I don't know. I think talking to your state representatives would be a good way to start. And then maybe they would have some ideas. I don't really know a lot about that. I'm very much kind of doing things myself. I'm glad other people are doing that. But yes, it should be. I mean, I don't know what's going on with Dr. Amy Klobuchar's bill about revising Section 230, but that would help a ton. It seems like it's kind of stalled in the Senate, but that would be a game changer because social media is really where this is happening.
Thank you. And I think, unfortunately, we are out of time for today's webinar. I know there's always so many questions, and Dr. Wallace, I think that's just going back to how great of a presenter and knowledgeable you are. I know there's a lot of great comments from the chat box about how much this is needed in public health and how well you have kind of armed us and helped us shed light on this topic. So thank you so much for being here. And everyone, the copy of the webinar materials and the recorded webinar will be sent out 1 week after the webinar, this live webinar. So if you have any questions in the meantime, please feel free to email us at arcipc@uab.edu. So thank you so much, everyone, for being here.
Thank you so much for having me.